Now you're on.
All right, so I'm gonna show you guys how to set up a art line today. So the things you need to set up an art line: liter bag of normal saline, the transducer cord. This is gonna hook to our monitor, which I'll show you that too. You need a art line kit, and you need a pressure bag, and then you need a transducer that's gonna hook in there. So, first of all, we're going to check and make sure all of our connections are tight on this. I'm doing it the wrong way. Did it again. Oh, that one fell off. That's nice. So you gotta make sure they're tight. Tight. I think that's it. So we're going to open our bag and we're gonna spike it, but then we have to unspike it because you cannot have any water or any air whatsoever in your bag. So this is the fun part, where you have to get literally all of the water almost till it's up there. And then plug it in there. Then we're going to put it in our pressure bag. And they slide right in as long as it's depressurized. There's a little hook for the bag to hold on to. And you're gonna hang it here. So it's usually to off, but we're gonna turn it this way so we can pump it up. And you can see the water, the saline starting to go through, and you can see the saline actually starting to come out there. And you're gonna pressurize it to 300, but there's a little green thing that's gonna pop out, and then that way you know when to stop. Which, there it is, 300. Now, this is open. I'm gonna put the transducer cable here, and the cord goes down. And it kind of locks in there. Then, next is turning all of these to here, and then this is like a pressure release, and it's going to start releasing water. Oop. Sorry, I forgot to turn this one off because we got to get the water all the way through. Okay, you can see the water just shot out of there. Okay. Now, this one go. Did that. Okay. Next, we're gonna check our line, make sure there's absolutely no bubbles anywhere in our line. We cannot have bubbles anywhere in the line. And if there is, you just kind of gotta, just like we do normally, you gotta flick them out until they rise up. Normally there shouldn't be too many because you kind of, if you spiked it right, it shouldn't. You're not gonna have too many air bubbles, and these little tiny ones are just a pain, but still wanna get them out of there. Okay, I think we're good. Yep, we got all of that. We did that. Now, we're gonna turn all of, which we did already, turn all the stopcocks to 9 o'clock, which that's not 9 o'clock. Well, that one's 9 o'clock. Okay. Oh, why am I getting water back? Hold on.
Because you're at 6.
Oh.
You're at 3 now.
Okay.
Aren't you supposed to be at 9?
It won't let me go to 9.
Oh, that's all right. Maybe he's just talking about with that one.
Must be this one. Okay. And then I think I changed these now. Alright. Well, we're going to go through and change these. This is just a little, it is a little different. But we're going to go through and change all these right now. Or do I do red to white? That's it. Yep. Sorry. Promise I've done this before. All right, red to white. So, and then once your doc, your resident has everything set, they want this ready right away, even though it takes them, depending on if it's a resident or the attending, takes them a minute to get it set up. So this is what we're gonna hook up to our monitor. So this actually just slides right in here. And then our cable, there's a special hookup right in the monitor for it. Now I won't be able to zero it like I'd like to, because obviously it's not going to be hooked to a patient, but I will show you that this pops up and where it will be on here. So this red is where your art line is going to show up. And after they get the art line in, you're going to hook it up to the patient. And then you have to zero it. And to zero it, you're going to click on that. And then you'd have to go down to where it says zero art line. And this part is going to be hooked to the patient. And it's usually going to be either side. But this is going to want to be, you're going to want to have, they can be real touchy. So sometimes it's going to be right midline with the chest, sometimes a little higher, but it's got to stay pretty steady. So this, and then for us to zero it, you have to basically take this off. You have to squeeze this again, and water, open it up, squeeze water again, and then you're going to hit the zero. Once you hit the zero, you're going to replace your cap and turn it back to off. So, and then you should get a nice, well, the numbers, look, I actually probably did it right. You'll get the red numbers, and this is going to give you a way more accurate blood pressure. You know, normally we do it with the patients that are intubated, anybody that's real critically ill and their blood pressure, we want to get, you know, we want to have a more accurate blood pressure. This is actually an actual art line kit. Did I miss anything? I didn't miss anything. So this is an actual art line kit that the doctors use. So we're gonna open it up so you guys can see. This is obviously a sterile procedure, and art lines are usually in the wrists. So we don't really do much to help other than get them a gown. So we have lidocaine because they're gonna numb up the area. You got your needles, and then this is gonna be they're gonna feed this onto here, and then they're gonna guide it in. So this is how long actually that's gonna be in the patient's wrist, and then this will get, I think they suture it down. Yeah, they suture it down. There's our sutures. They're gonna suture it down, and then you're set. And this is gonna be the guide wire that's gonna go in to the patient, and then they'll pull that out once they get it in there. And that is that. Like I said, we don't do much other than just kind of help. If they need something, and that's that.